Good afternoon, everyone. My name is Dan Harrison. I'm the CEO of NuPath, and you are here for another edition of NuPath Live. The date is December 17th. Let's get right into it. There are 17 million, over 17 million COVID cases now in the United States, and we have passed the 300,000 dead mark. You know, back in the early days of this, when we were at 60, 70,000 dead, and Dr. Anthony Fauci was saying that we could be at 400,000 dead in this country by the spring, I thought that was an outrageous. I just couldn't see how we'd be there, but now I do, and especially during this recent surge in Massachusetts, we're currently just over 300,000 cases of COVID and 11,513 dead. We here at NuPath now have 6 houses that are under quarantine, and increasing numbers, it seems, every day as the additional test results come back. And I hate to say it, but a lot of this is related to Thanksgiving and the exposure that people had as they went to their various left our programs and went to the homes of their families. We're going to bring Matt Johnson on in a little bit to talk to us today about some new developments with the vaccine. But I'm going to just tell you right now that this Christmas is going to look different. And we have made the decision that we are going to be asking families, imploring families, with every bit of energy that we have, to leave your children at home with us this year and help us stop this thing from getting even further out of control throughout this organization, and to do our part within the state and the country to try to stop the spread before we can get the vaccine. We'll talk more about that. We heard in the news that we have had a higher than expected 885,000, to be more clear, initial jobless claims from the previous week. This is the second straight week it's been above 800,000. And there are, all across the country, states that have imposed certain more extreme COVID-19 mitigation measures that have included various forms of shutdown. So when the governor announced last week that he was moving us back a phase and that would have an influence, Massachusetts citizens are not alone. This is something that well, you can't be alive and not know a lot of this already. We did a little good news. Those of you who are paying attention, Jerome Powell of the Federal Reserve said that in spite of everything going on, the economy, he believes, is still pretty strong. I'm telling you this because our health and safety is always number one, but of course the fiscal situation at NuPath is something that is deeply concerning, and something that our industry, we're not alone in that, but are paying very special attention to. Jerome Powell is somebody that has been speaking for months and months about his desire to see more of an infusion of federal money into the economy, and believing that, and knowing that there are businesses, NuPath may be one of them, that have been in existence for many, many years, and that if they can just hang on a little longer until the spring, Chairman Powell seems to think that we will have a rebound from this, and that we can even be at a 5% unemployment rate by the end of the year. It's optimistic, but he certainly knows more about the economy than I do, and if has this optimism, then I'll cling to anything at this point. Other piece of good news this week is that we know, as we speak today, 1 week ago, we heard about the Pfizer vaccine that was given the emergency use authorization, and now the second vaccine to hit the market, or will be, Moderna, is being considered for the same EUA, emergency use authorization. And then, even as much of an hour ago, we heard that the congressional negotiators are getting closer to approving the $900 billion COVID-19 relief package. We don't know the specifics, but even a few weeks ago when we had Representative Richard Haggerty here, he mentioned some of these things. There will be in this stimulus package some vaccine distribution funds to assist states. They're talking about some form of aid to businesses, and then related to the individual citizens, $300 per week federal unemployment benefit boost, and a $600 stimulus check for most or many Americans. So, of course, I don't have anybody calling my cell phone telling me what is going on at the latest moment. I'm just getting my information from what I'm sure many of you are reading. Why do I mention this? Well, we know that our state is in desperate need of assistance from the federal government, and hopefully, if this decision can come down before people scatter to the winds for the Christmas break or Christmas recess, that would be a very positive thing for I think our country. And as we decide to stay home this Christmas, to do our part, protect our families this Christmas by not insisting on engaging in so many of the rituals that typically and routines and traditions that this time of year often brings. It's something that has to happen, guys, and I can't say it enough. We see what we're dealing with now from the decisions that were made a few weeks ago, and I beg you, please, let's all do our part to stop this. All right, I am going to ask Dan Lannon to join us. Most of you know Matt. He's director of our clinical support. He has been sort of tapped to oversee NuPath's task force on the vaccine rollout and the work that we're doing in concert with the federal and state governments. Matt is about as much an expert as we have in anything having to do with the vaccine. Matt Johnson, welcome to NuPath Live. It's good to see you again.
Good to see you. Thank you for having me.
Thanks for being here. So last week or 2 weeks ago, I think it was, when we talked about this, you were terrific and you kind of helped us kind of understand some of what we knew. I think that I wouldn't say that our optimism has been tamped down, but as you know, you can hear something in the big, sort of press release, the big announcement, that hits the news. And then as you start to kind of find out a little bit more about the details, you can learn different details that are actually very relevant. We're learning that when we initially heard from the governor that workers in our industry, people that worked in congregate care settings or worked with people with disabilities, would be considered to be part of phase one, it was just naturally we were thinking that that would be all of us, but it may be that there is a much more refined and very specific way that this vaccine is being administered. I'm going to give you a minute to update us, 1 minute, but I've been watching as data is showing that across the United States there has been an increase in the number of Americans that say they would get the vaccine. In September, only 51% of Americans said they would, and now that's risen to 60%. I know that I was ready to, roll up my sleeve or wear a tank top to work if it need be to get my vaccine. Now it sounds like I may have to wait longer as well, which makes me want it all the more. What do we know about where things currently stand? Can you kind of just summarize for us and give us some updates on what things are looking like regarding that?
Sure, I can. Yeah. We did hear from Walgreens, who is our contact for the long-term pharmacy program. They let us know that we would be in line to get the vaccine, and that they are looking to arrange dates with us in the near future. They've asked us to line up the staff and employees and people we support in congregate care living to get the vaccine? Who will say agree, as you said, to jump in and get the vaccine? You know, one of the challenges we face is that we provide a lot of day program services, and for us, that's a challenge in terms of thinking about. We've been reached out. Walgreens has reached out to us to say congregate care living, so the people we support in residential supports and people that we support in day program services only don't meet that category at this time. So we would really be hoping that they would get the vaccine through their residential providers or people that are living with their families, that they would eventually have access as their families do down the road. But for us, it's going to really be that focus on the residential programming, people that are in those 24-hour supports that will be the first phase of getting the vaccine. Um, you know, they are ready to go in terms of the process. We have the system set up for entering information regarding staff that get the vaccine that will allow the government to track anyone that's gotten the vaccine and really get the information and the feedback from Walgreens around any side effects or anything in terms of the vaccine. And they are ready to go in terms of setting up clinics with us. So we have a site, we have a location, we're ready in terms of how that process will work. Really, I think at this point, it's waiting for Walgreens to have the vaccines in hand and then to reach out for the final dates. You know, in terms of the vaccine itself, we know that it's not the immediate solution. It's not something that's going to change the way we need to behave in the immediate days after getting it. We know there's a second dose that needs to come 21 days after, and we know after that second dose that there is a period of about 4 to 6 weeks, maybe even a little longer, before people can feel as though the vaccine has fully taken effect for them. There is also the question of whether the vaccine will help us create antibodies, or will it just provide the opportunity for people to have that less intense case of COVID if they are exposed and get COVID. So there's some variables there that we certainly need to think about. And I think, as you pointed out, coming into the holiday season, coming into this, final stretch of the holidays at the end of December and January 1st for New Year's, thinking about what we do as, with our families and how we stay safe. I, as you said, would urge people to take that time to stay home, to stay in that immediate cohort that they have, the people that they're having contact with every day, in their houses, and not to extend it out. I would say if visitation can be limited, if you feel that you can avoid taking your son or daughter home at that point in time, I would do that. I think we may be in the final stages of this. We know that the vaccine is coming. We know that the holidays will pass. And at some point in the springtime, we may be at a point where enough people are vaccinated that the positivity rate will drop dramatically. It doesn't seem like this is the time to take that risk. It seems like the time to kind of hunker down and make sure that we're safe and that we can make it to that, period where the positivity rate drops. This has certainly been the largest number of people we support and the largest number of staff testing positive since the end of June. So we're
call it. We are. Well, let me rephrase that. The men and women we support, whether they be in our residential programs or our day services, that's our number one mission. But their families are critical and key to providing, the very best kind of care that we can. And so we need to have the kind of partnerships with families that they trust us, that they listen to us, that we kind of have a mutual understanding of what we're trying to accomplish. So it's not really in our position or my position. I wasn't even sure I was going to talk this much about it today, but I guess I am. It's not, I never want to take the position where, and nor could I legally say you cannot take your kid home. Because if a family member really wanted to march up to the door and say bring him or her out to we would do that. But and we could put some restriction in place if we were to say, look, you take your kid home, they're not coming back until this is all over. We must, seek, some way of, sort of putting the barrier down. But to do that is also counterintuitive in some ways, because if families care about NuPath, they must also care about the fact that we are in a extremely precarious financial situation right now. And if we lose people from our residential programs by way of their, the income that we receive from them, and I don't want this to be juiced to money. This is just one part of this terrible, terrible, awful experience, but it's a reality that we have to be thinking about from a business perspective. If families all did say, well, we want our, son home for Christmas, that's, what we're going to do, and then we don't care, we'll keep him home for the duration, then in some ways that's almost a double whammy for us, because then we suffer by the loss of that that income, but we can't have somebody else move into that bed for that time, and we can't, it's not like a hotel that you're not here for this week, we're going to, have your room filled with somebody else. And so I guess this is just, me, talking about something that matters deeply to us as an organization, to me as the CEO of this organization, because these are all things I have to consider in order for us to stay, a viable force, going forward. But just, beseeching our families to kind of, not, make this about this one specific case, but to look at it, sort of, with the long term, that this is one, we're just asking you to, we're all making sacrifices here. We're not doing things we want to do. We're not going to be with family that we would otherwise be with, and asking families to do their part. So it may be that most families have already made that decision. I don't know, but if they haven't, and if they happen to be listening to this broadcast, I wanted them to hear that this is something that is a very difficult, sort of set of choices that we're being asked to consider. I guess that wasn't a question. I was just making a comment. So, Matt, you've also been involved in the well, let me finish up in the vaccine. So, the first vaccine that received the emergency use authorization was the Pfizer BioNTech. We know that had a lot of news on Monday. I think it was more or less as we said it would be when I talked last week. The EUA was voted upon, and on or the advisory board made the recommendation Thursday evening. On Friday, the FDA, authorized this emergency use, and so we started to see, these trucks rolling out, and all kinds of stuff in the news about the first person being vaccinated here or there. You're talking to people all over the country. I mean, it's reached the shores of Guam. It's everywhere that the United States has got sovereign rights. So now we have in the news the Moderna. Is there anything more that you've been hearing about that? I know they both work very similarly, and I know you're not a virologist or anything like that. But I'm thinking more about the side effects. Have you heard anything more about either the Pfizer or the Moderna virus related to side effects? Are they both pretty similar, if by your reckoning?
Yeah, from what I hear, they're very similar. And I did ask the representative from Walgreens, and she told me that they were very similar. She believed that both of the vaccines would work effectively, would have very similar side effects, if any, and that, in terms of which one we would get, I believe it's the Moderna that doesn't require quite as cold storage.
Yeah.
But she told me that they can do the storage for both of them,
Mm-hmm.
that they're fully equipped to do that Walgreens has set all of this up, and that when they roll in, everything will be cold in the cold storage that it requires. In terms of the side effects, she said that the pattern would be very similar. And she reiterated that if you're seeing some of those side effects, it means your body's working and that the vaccine's working. So, for us, I think we probably don't want the entire company to get the vaccination on the same day, just because we may all have some side effects on the same 3 days that follow. But certainly, it's something that we'll need to monitor with Walgreens in terms of reporting the side effects. But, it's exactly what you hear on the news, that the side effects mean it's working.
Well, from what I've been reading, Matt, correct me if I'm wrong, there have been, maybe I've heard one case of somebody that had a allergic reaction. I forget where it was, Maybe there's been more since, but mostly what you're hearing about is soreness, localized soreness at the site of the injection, and maybe, you know, just feeling a little under the weather maybe for a day or so. But have you been hearing about people that have been, carrying, experiencing high temperatures? And I was talking with a colleague from another organization, and she, we were puzzling over some information that we'd received, wondering whether or not it was going to mean that whole houses were sick at the same time. I haven't heard anything that's that severe. Have you?
Yeah, I've heard that you can get a fever, but not a severe fever.
Like
But
not like
I've heard people,
103 or 100?
yeah,
No.
yeah, I've heard people that a fever can be one of the reactions to it. Um, I've heard about the allergies, but again, probably same as you, it was the stuff initially in England when the vaccines were administered, and since then, I haven't heard much. It is on a list of the final conversations to have with Walgreens prior to them coming out to us. We have a list of questions we're going to ask in terms of, the possibility of a severe reaction, the timeframes for that. If someone has had COVID within the last 90 days, should they get the vaccine or not?
Mm.
And, so those type of questions we will get clarification and then share it with the staff and employees that come to get vaccinated.
Mm-hmm. Well, we've talked about the fact that people the families do have the right to withhold, their consent. We're certainly not going to be vaccinating any of the people in our care without the consent of the guardian. That's the law. That's what we're going to do. And I know that some of the nurses have been doing some upfront work, and at least it was my understanding that the families were being reached out to, and in some cases, do you know if that's stuff that we've been able to achieve? Have we been getting the consents thus far? We're not at that point yet.
We're not at that point yet. We actually will be starting that on Monday. And in terms of, I think there will be people that say they don't want to get the vaccine and they don't want to consent to it for their loved one, or, and staff or employees that say no. And it's a hard decision to make, I'm sure. Everyone has their own sense around it, or their own understanding of it, and their own fears. In terms of what we're going to be able to offer, it does seem like we'll be able to offer several clinics for employees, and then we'll offer a second round of clinics that are 21 days apart. Opting into that first round of clinics will get you the first vaccine. Once that second round comes, if you did not do the first round of vaccines, you won't be eligible for the second round. So Walgreens is being pretty, they're limiting the access to the vaccine. They're not going to bring truckloads of vaccines and then anyone that we want can just come and get a vaccine.
Yeah,
they want to know who the clients are and who the employees are, and they want almost an exact number. So when HR reaches out to people, or your manager or director asks you, and if you say yes or no, that decision, once you make it, you may not have access to that vaccine again until April or May, when the general population gets it. Mm-hmm. So we'll have that first round, and then we'll have anyone that opted in, they'll get the second round. And then from there, hopefully, if there are people that need it, they'll be able to get it by demonstrating that they work in this field somewhere else. But that's not a guarantee at this point in time. Mm-hmm. It may be that anyone that doesn't opt in may be waiting till April or May.
So that thing in the background where behind you is not a super cooled deep freeze that's full of Pfizer vaccines by any chance?
Yeah, no Pfizer vaccines in there.
No, it's just a regular fridge, is it?
Just a regular fridge. Yeah.
So none of us are going to be storing these extra vaccines in case we know somebody that would be interested in just sliding in and getting one. It's gonna. This is such a major undertaking for the government to try to, ensure that it's protecting its population to the best of its ability, and trying to track all this and monitor. Americans, we're a funny lot. We're funny, in the sense that, we're very, very suspicious of our government. We're very suspicious of, being told we have to do something, and, being mandated to do something, even though much of civil society is maintained and well ordered because of rules and laws and things that we have to do to participate with our fellow mankind. When we most of us wear seatbelts when we get in the car, and drive anywhere. We understand that that's, a way to protect lives, but that was a massive undertaking, getting, states to say that they had to wear seatbelts. So it's any time that you're trying to do something, kind of wholesale across the board is, I think it can be very difficult. Whereas in Europe and many other, the European countries, people see the government as being mostly, benevolent and acting, within their best interest in mind. Whether that's true or not, I don't know. I don't want to get into that argument, but I think that the alternative is too gruesome to think about right now, and we certainly know that this COVID doesn't care whether you're European or American when it comes to what you think of the vaccine. It's going to continue to rage. And we know lots of people that get it that have had very, minor, sort of discomfort. People that have said it really was no big deal. And then we've had people, in fact, I talked about it a week or two ago in a sister organization, a 35-year-old employee that had been there 10 years died from COVID. And I think it's the uncertainty of that is just really troubling. So let's move the vaccine from the vaccine. And can you just update us around the testing? We talked about this being a requirement of the Commonwealth that as being, providing the services that we do, that we're getting the surveillance testing, they call it, or to manage and to capture. In fact, I myself had another test yesterday, and I should have checked for the results, but how is that going? And have there been any changes? What would you say? Would you say it's been an effective way of uncovering some of these cases that otherwise might not have been detected?
Yes, I would say absolutely it's been an effective way to catch those cases that would not be detected. A lot of the case positives that we having are those asymptomatic people. They don't have major symptoms or any symptoms they've recognized, and the testing that they got, that surveillance testing, really is showing us who has it and helping us get them to a safe spot and out of contact with other people. The testing is great. Right now the nurses are working really hard. HR has been working really hard to keep the database going and to check every employee in as they come and get the testing. We don't have any employees that are saying, I don't want to be tested. Everyone is getting in and getting it done based on the schedule they're required to do. Day program, we've been testing everyone weekly. So every employee's been getting weekly testing. Residential programming, we have some houses that are doing the biweekly schedule. So when it's their biweekly period of time, they're getting in and getting it done. And then we have a few houses in Essex County that are getting tested every other week. So because the positivity rates are high there, people are doing it. They're getting in and getting tested. When we have exposures in a home, we've had someone test positive. In any setting, we have people lining up and coming in and getting their test done. So it's been great, and the results have been much quicker. It's really been nice to see that you can get tested on a Wednesday, and then either Thursday night or Friday morning you get your results. It's not the 5-day waiting period or longer sometimes that we had when we first started doing the testing.
It's been interesting to see that even as the sort of therapeutic sort of arm of our response as a nation or as a world to this pandemic, the finding the vaccine, that's what really gets a lot of the news. But it's clear that a lot of work, research, and development continues to happen with the testing and diagnostic side of things. I don't know if you heard in the news just yesterday, I think it was, about this new home test that is going to be coming to market, and it sounds, from what I've read, that it's it's simple, swab. You get your results back much as you might, a pregnancy test, that you would buy at a CVS. And this particular test is designed so that you would download the app and you would get results through that app, but that would be connected to the CDC, and it would provide a way to collect data for cases that may be being diagnosed but untreated, or diagnosed and understanding, from the perspective of this contact tracing, or where is this person and how could we try to control the search. Problem with that would be ideal. And that's new. I mean, that would be so great if it was something, because you could think about a future where every day before you go to work, you do a swab, test yourself.
Yeah.
somebody's waiting to get on the van with other people, swab themselves, test, they come back negative, on the van they go. But it's still $30 a pop and
Yeah.
for this test. And that is just too costly for anybody to be thinking about doing that every day or widespread. But I believe that as in many, sort of fields of discovery or development, that cost will come down, that there will be other tests soon to market that will be doing similar sorts of things. I know there is a self-test at home that you can do at home now, but you still have to send the swab away. We want to get something that's easy, quick, disposable, cheap, and that will be another asset in our arsenal. Is how do we fight this thing? Have you
Yeah.
heard about any others, or do you know anything more about that?
Well, that was the big one that I heard about as well. And I know that the state is looking into being able to acquire some of those so that we would have them in 2021 to access some of those tests. I don't know that we would be using them on a daily basis, but they might be an option for staff testing and people we support testing when there's a need for that. And I did hear about a potential test that you could do where you would do like a scratch and sniff, and you would then be able to smell, see if your sense of smell and taste had faded or is gone. So it might be it's obviously one of the big symptoms when you do have it is that you lose that sense of taste and smell. So it's an interesting angle in terms of getting at, identifying a symptom that people might not recognize right away.
Well, that is why I'm eating so much, because I keep testing myself to see if I have COVID. um, yeah, I know every now and then I'll taste it and be like, I don't know if could I taste that? I would, I'll take another bite just to make sure. Man, in just the last minute or so that we have you, I'm just going to thank you for your, not just your sort of intelligent contributions to the planning and the execution of this, but for just your physical brute strength too. I think it was Gen Z was telling me yesterday, which took my test, that I was asking her how things were going. Was it difficult for some of our folks that we support? Maybe some of them that, it could be a scary thing to see somebody coming at you all gouged and shielded and masked and gloved, and I mean, no wonder people feel a little put off by that. And she was talking about, did you help through, I think it was Paul, I won't use his last name, but she said that he was struggling, that you had to really get in there and help to get the
Yeah.
test.
Yeah, sometimes I feel like it is scary. The nurse is coming at you and you don't know exactly how it's going to feel. And it's that instinct too. When someone puts something in your
Yes.
nose, you pull back. So it's sometimes it's nice for someone to have a place to put their head, to put their head on your chest and to be able to lean back and push against you. And then to be able to have something to hold like your hands or your arms and to brace themselves for that. It's necessary. I think, it's hard to explain to people that it doesn't feel like the old one. Sometimes when it's coming, I keep thinking myself, it's that one that goes way up, and it's not that bad anymore at all.
Mm-hmm.
But, it is hard for some people. So
Well, I was a little worried. I was a little worried when Jen was coming at me, and she threatened she'd call you if I didn't, shape up. And I said, well, I didn't want to do that to you, so I managed to get through it all right. We met this morning as a leadership team with Zoom, of course. In December, we try to use the time that we have standing time to kind of think about the holidays and do some fun things. Even though I mean the holiday's still happening, it's just going to be a little different. This morning we were talking about what kinds of things bring you joy. Like, where do you find joy? I have the slide up behind me to remind us about joy. I think it's important that during these times, as we go into the last crushing and discouraging, days of this pandemic, before the vaccine's here, before the vaccine's widely distributed, while we're missing people that we haven't seen for a long time, while we're shut out from being, congregating with family, friends, office parties, all of those things, that we deliberately and intentionally, seek out those, occasions for things that make us smile, bring us happiness. Did you have a picture? Were any of those pictures that we submitted, were they yours? We were supposed to send in a picture of something that brought us joy.
Yeah, I submitted a picture of my dog Nugget.
Oh, that was you.
He
Yeah.
was wearing an elf costume with a little stuffed elf next to him.
That was really cute. That was really, yeah, we didn't know whose was whose. So, do you know which one mine was? Mine was Cubics dressed up with the lights and the Santa.
Oh, okay, I saw that. Yeah.
Yeah, he's kind of dorky. I had another one of John, my husband, who was wearing this ugly Christmas sweater with my face on the front. Not the sweater brings me joy, but he brings me a lot of joy, and I we look to those kinds of things, as does this organization, and we're all fighting the same fight here. The only the main opponent is this thing we cannot see, and yet it's just been so deadly and just taken such a devastating toll on this organization. Well, Matt Johnson, as always, you've been just an exquisite guest and deeply knowledgeable. Appreciate you taking a few minutes to share with us. And if I don't talk to you, I hope you have a really great holiday and a Merry Christmas.
Thank you. You too.
Okay, Matt. Bye-bye. All right, ladies and gentlemen, thus concludes. We're going to keep it a little shorter today. I am going to just point out that next week, at this time, will be Christmas Eve, and we are not going to be having a live broadcast on Christmas Eve to give everybody a chance to get home, lock their doors, and stay put for the whole holiday. But the following week, 2 weeks from today, will be New Year's Eve, and we are going to have a special broadcast that you will not want to miss, to think about the year that we're saying goodbye to, and to think about how we are going to come together in 2021 in a way that will astonish the world and kick this COVID thing to the curb and beyond, and how we're going to rise on the other side, and make 2021 the year that we come back roaring. Guys, we got this. Hold on. We just have a few more weeks, and things will be getting brighter, I promise you. And have a wonderful holiday season, everybody out there, if I don't see you. And we'll talk before the new year. All right. With that, I sign off. Thanks, everyone. Goodbye.